Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a June 5th, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County added 2 new COVID-19 cases since yesterday. As of June 5th, Dubuque County has 356 positive COVID-19 cases. That's a rate of 368 per 100,000 population. No additional deaths were reported, so a total of 21 deaths in Dubuque County remains. 5,968 people have been tested in Dubuque County, and about 6% of the cases tested have been positive. 5 individuals are currently hospitalized, and 196 people, or about 55% of Dubuque County positive cases, have recovered to date. 1,063 Dubuque County residents have had serology or antibody testing, and 60 of those, or 6%, have tested positive for COVID-19 antibodies. The Dubuque County EpiCurve and 14-day trend line are posted and updated every day on the citydubuque.org COVID-19 website. Dubuque County Public Health and healthcare providers are providing testing to those who need it the most, and according to public health guidelines. We continue with targeted testing and contact tracing testing of high-risk populations and groups, in addition to the testing happening at local hospitals and clinics. Of the 9 counties with populations over 50,000, Dubuque ranks 3rd in testing per capita. Dubuque County ranks 6th on the positive COVID-19 cases per 100,000 population. A reminder that anyone who is not offered a test by a local healthcare provider or who does not have symptoms can go to any Test Iowa site, provided they take the Test Iowa assessment at testiowa.com. The state added 389 cases since yesterday. As of June 5th, 2020, Iowa has a total of 21,095 positive cases. In all, about 1 in 18 Iowans have been tested, and about 12% of Iowans tested have been positive. 11 additional deaths were reported in the state since my last report, for a total of 591 Iowans. The age group with the second highest incidence of death is that of the 61 to 80-year-olds, who have experienced 41% of all Iowa deaths. 297, or 50% of Iowa deaths, are residents in long-term care facilities. Currently, 299 cases are hospitalized around the state, and finally, 12,510, or 59% of Iowans, have recovered. Today, the Iowa Department of Public Health released guidance specifically for long-term care facilities or nursing homes. Our public health management team will be assisting nursing homes with understanding and implementing all the measures on how they can move through phases of reducing some of the restrictive measures within their facilities, including visitation, testing of additional staff and residents, daily activities for residents and staff within the facility, along with ongoing infection control measures. The Iowa Department of Public Health also released guidance for baseball and softball teams for the summer. The guidance reminds those in high-risk groups not to participate, including players and coaches, along with the monitoring of fever and symptoms prior to the start of any practice or game. This guidance can be found on the Iowa Department of Public Health website at idph.iowa.gov under the Coronavirus tab. Here we are at the weekend. At times the week seems to drag and I'm overwhelmed with all that needs to be done. And then on the other hand, Friday comes around and I can't believe it. I want to continue to emphasize how important it is for everyone to practice healthy behaviors every day. Eating nutritious foods, including plenty of fruits, vegetables, legumes, and nuts, lean meats, and dairy in moderation. And also staying physically active in some manner every day, and taking time to meditate, pray, or just relax. Exercise boosts the immune system, may prevent weight gain, reduces stress and anxiety, and improves sleep. I know on the days I'm not able to exercise, I'm not as productive, nor am I always in the best mood. So healthy lifestyles definitely affect our brain health and general well-being. So in case you haven't heard, yesterday I had 3 free hours between 3 and 6 p.m. So I said to my son, Nick, let's go out and play 9 holes. So in between meetings, I'm doing one of my favorite activities by walking and golfing. And on top of it, I sink a hole-in-one. I'm calling it my COVID-19 pandemic hole-in-one. So good things and fun things can happen during a pandemic. In closing, as we approach the weekend, we recognize that we've had some peaceful and productive protests in our community. Here are some public health reminders for if you're attending community gatherings and outdoor events. Of course, wear masks and keep some distance from others. Wash or sanitize your hands as much as possible, especially when you return home. If you're feeling sick, or if you live with someone who are at most risk for COVID-19, please consider staying at home and supporting events and causes in other ways. Thanks for tuning in today. Let's all continue to be safe, be smart. When in doubt, don't go out, and remember, we're all in this together.